back to The Remedy, brought to you by Coos Health and Wellness. My name is Eric Gleason. Today we are joined by Florence Portal-Stevens, the Public Health Administrator from Coos Health and Wellness. We're going to talk about the Community Health Improvement Plan and what that means to the community. Thanks for joining us, Florence.
Yeah, thank you for having me.
So, what exactly is the Community Health Improvement Plan?
It is a plan that is being set up as part of a collaborative process with a lot of community partners, and the idea is to tackle some of our health outcomes as a community to try to improve them.
Okay, so what community partners are involved with this?
Well, we have a lot of community partners involved with the current Community Health Improvement Plan, or CHIP. We have hospitals, so Bay Area Hospital, Coquille Valley Hospital. We have community-based organizations such as ORCA, the Department of Human Services, of course, Coos Health and Wellness. We also have community members. We have, of course, our coordinated care organization, Advanced Health, that is quite a leader in the implementation of the CHIP, and as well, fund some of the project that the current CHIP has been undertaking.
How does this group decide what goes into the CHIP?
You may have heard of what's called a community health assessment. Mm-hmm. So pretty much once every 5 years, the community as a whole, or trying to be as many partners as possible, is looking at the health of the community through a collection of what we call secondary data. So we look at our smoking rates, we look at our major cause of death, major comorbidities in the community, and we also talk to community members to ask them, what is your perception of the health of the community? Mm-hmm. And with the help of a consultant, we gather all that data and we put it in a nice report. So from that report, we all meet as community partners and we talk about, okay, so what do we think is important for us to tackle, both on the data front and also on the community readiness front, like what is the community willing to support? And so we are in the process right now of starting this conversation again for a new community health improvement plan. So I think that's going to be interesting, and hopefully we're going to have enough voices at the table to really make sure that the priorities that are chosen are relevant to our community.
Yeah, well, it's nice that many different organizations involved in the health and welfare of our community come together to actually try to push forward
Absolutely.
The health outcomes of the individuals in the population
Yes.
that we have here. So how does one get involved with working with the CHIP?
Right. So right now the structure of the CHIP is we have 5 different areas of work, and we have 5 committees working on those areas. So we have a committee working on tobacco prevention, one working on obesity prevention through healthy eating, active living, one working on suicide prevention, one on access to healthcare, and the last one on access to prenatal care. So they all have a chair, and so I think the best thing to do is probably to go on the Advanced Health website, which is, I believe, advancedhealth.com, and go on the CHIP tab, and you will see a list of who to contact if you're interested to work with one of those subcommittees.
That's great. So if you would like to get involved with the CHIP and help these individuals and these organizations move the health of the community forward, please go to advancedhealth.com, look up CHIP, and get a contact with one of those subcommittees. And for the Remedy and Coos Health and Wellness, we thank you for joining us, and together we can, whatever.
Yes.
We can do whatever.
Together
we can improve healthier communities.